Okay, we are starting. Welcome, everyone. And I am so happy to see so many familiar faces as well as new faces. So, I've been doing weight loss for years now. I got my certification in medical weight loss. I used to do medical supervised, doctor supervised weight loss way past when I opened my clinic back in 2018-ish, helping cancer patients, but weight loss was always a passion of mine because I can see what happened when we lose a few pounds, right? But today I'm going to talk to you about a new concept of losing weight with herbs. Not only losing weight, but also losing fat with herbs. Okay, it is very possible. And this is something that I've been doing behind the scenes with my patients, and I want to just put it out there. So that's why you're joining this info session. But weight is a huge topic that will live on forever. We're all talking about weight loss. There are so many programs out there about weight loss. We all want to lose weight. We want to feel better in our bodies and feel great in our dress, right? Losing 1 pound can significantly benefit you. But weight loss equals better health and also equals happier humans. What I want to bring to the table is different ways of losing weight, because there are two ways, right, of losing weight. You can lose weight the healthy way or the unhealthy way. If you lose weight and you look older than your age, your skin is super saggy, you are exhausted in the whole process of losing weight, you have low stamina, low energy, you are starving yourself, you are fearful of gaining the weight back, and you feel like you have to continue doing whatever you're doing to lose the weight, that is the unhealthy way of losing weight. Okay, that is misery if you call me. If you ask me, like, it's miserable. That's a miserable process. This is not the way to lose weight. For me, when it comes to weight loss, you have to look at three things. Three things. Your mindset, the cognitive function, meaning that when you lose the weight, you need to feel great mentally. You need to have this cognitive function where you can get up and do things, move around, and get the house chores taken care of, like literally looking forward to starting your day. Your brain has to be on when you lose weight. The second piece is the physical piece, which is the piece that most people look at. Let me try this product. Let me try this program. Let me try this restrictive diet, right? But you want to implement a safe, effective, and sustainable process, meaning that that's something you actually enjoy to do. You're not going to do it, and then when you stop doing it, all the weight comes back. It has to be sustainable. I see so many patients in my practice that are doing the latest, greatest tactics. And then at the beginning, they're losing weight for sure. But it's like there's so much they have to do, or they're doing it with so much resistance, or they're doing it not really feeling great in the whole process. They are tired, they are exhausted, they are hungry, they are afraid, like they are moody, they are irritable. The sugars be dropping. Like, we don't want to do that. So that's the second piece, like incorporate a process or implement a program or like whatever, a procedure that's going to give you a safe and effective way, sustainable way to lose the weight. And then the third component of weight loss in my book is transformation. You have to look amazing when you lose the weight, meaning that like all your body composition has to tie in together, like flatter stomach, a nice little hip, like your figure has to come. Because sometimes I see patients lose weight or people lose weight. They lose the weight, but again, they look older. The skin is saggy. The arms are flat. Like, we don't want to do that. We want to have a nice transformation. And weight loss should affect every single part of your life, your mood, your libido, your hormones, your happiness, like your physical aspect. You want to wear that dress and feel confident and have like the self-esteem that you're looking for, right? And feel good in your body. Because if that's not the case, then the weight loss we have been implementing will not work. It's miserable. Because to me, when we lose weight, it's like we are rebirthing ourselves. It's like a rebirth, a new life. You feel in control, you feel motivated, you feel empowered, like you feel so good that you can just conquer the world. That's weight loss in my book, right? So because The way I see weight loss is completely different than most people. So I want to start with that. The three things that we need to focus on when we're losing the weight: the cognitive function, like the mood, and you should not be anxious or irritable or depressed. Okay, you should have stamina, energy, like your blood pressure should be controlled, your blood sugar should be controlled, you should have a nice transformation, and then you just feel good overall. Like there's no aches and pains. You want to get up and go and get things done. And that's what I want to talk to you about today. And with herbs, you can achieve all of that. Okay? So why are you here? Right? Like you saw this wonderful flyer, or you hear me talk about it, or you see a post and then you signed up to be here today. But why? Like, what is it that you want to get out of it? So for whatever reason you are here, I just want to congratulate you for taking time and joining this info session today. Okay? Because I'm sure you have a desire to lose weight and an unwanted fat. You have tried many things to lose weight and then nothing worked. Or you lost some weight and gained it back, right? You spent tons of money, energy, resources, Googling all the things, trying all the products, signing up for all the, again, no results, or you saw little outcomes. When you stopped trying that thing, the weight came back. Or your weight gain is getting taking control of your life, right? You go into your doctor's giving you a diagnosis, whether it's diabetes, high blood pressure, autoimmune, hormonal imbalance, like it's literally taking control of your life and you want it gone. Okay? Or you have tried of losing weight, like you wish you can lose the weight and keep it off and maintain it, but without doing all the crazy things out there. Like, I just want to lose the weight and feel good in my body and be healthy losing it without trying the most. All right? You probably feel frustrated and anxious and depressed, loss of confidence. Again, you've tried many things, nothing worked. Maybe some body image, because I know a lot of my patients don't want to look themselves in the mirror. When I ask them, when was the last time you look at yourself and tell yourself that you love yourself? They'll be like, no, Dr. Jency, I don't know this person that I'm looking at, so I don't look in the mirror, right? So that's a body image. Or you wear like clothes that's so big for you because you're trying to hide something. You're not comfortable within your body. You're not comfortable with the person that you are. Or you just want to give up. Like, Dr. J, I've tried so many things. I really don't see what would work for me. I'm just going to stay like this. I'm going to stay miserable. I'm going to accept the person that I am. I'm going to accept the diagnosis. I'm going to accept whatever. I'm giving up. If that's you, yes, I do want to congratulate you, but I also want you to be compassionate with yourself. And I want you to not do that. Please don't do that. Because obesity or overweight is continuing to rise, right? Obesity is tied to so many health conditions. Like, again, as I mentioned, diabetes, high blood pressure, high cholesterol, liver disease, stroke, heart attack, hormones, cancer. And because many people are obese, there's a social stigma attached to this. And you can also lose an employment, and also you have some social disadvantage, right? Because I see patients that will come to me and they're not being treated fairly because they're obese, or people are talking about them, which is literally not fair. That's not the way it should be. Obesity is the leading cause of many health conditions. Again, stroke and heart attack, to say the list. The road to weight loss, as you're looking in this picture here, can be so long, right? It's like, how do I get from the person I'm here now to the person I want to be? Sometimes we don't see it. It's like it's so long, all the things that you have to do. But I want you to really have an open mind, willing to receive, because again, this is something new we're doing today. And I really want you to create time and space for yourself. I don't want you to criticize yourself. I want you to love the person that you are today. Because the person that you are today is going to help you be the person that you want to be in the future and also tomorrow. It is not fair for you to be, for you to be mean to yourself. Like, it's love is what's going to get us there. Okay? So love the person that you are today. But I have to tell you, this info session or the program we're going to discuss is not for you. If you're happy with the weight loss journey that you are on, right, taking whatever injections, the pills, forever, and you're happy, then you don't need to be here. This is not for you. If you believe weight loss is a quick fix, I'm going to take a pill today and I'm going to lose 10 pounds tomorrow. That's not the case. If you believe taking a pill or medication is the only way to lose weight, I want to tell you something different today. Or if you are not open to learn something new, or you are not open-minded. Because for me, herbs is the way. Like herbs. There's nothing better than herbs. It is old traditional medicine. People use herbs. The more you know about it, the more you can use it for all purposes, for all diseases, and to tackle many symptoms. So this is not for you if you're not willing to follow recommendations and you have resistance to natural medicine, because somebody told you things, those herbs don't work, or you Google it and you see tons of misinformation on Dr. Google, or you spoke to your doctor and your doctor said, hey, don't do it, just take the medications. This is not for you. Well, if you want instant gratification, like everything that is good takes time. But my promise to you today is to share something that is possible, something that's going to help you move forward from where you are now to where you want to be. But I'm asking you to remove all the barriers, right? Like all the barriers from learning, and allow yourself to receive. So that's how you're going to see what could be your next step, or what is your next step should be in losing the weight using the different tools and method. All right. But I want you guys to stay until the end. This is not like a 3-minute thing, because there's so much information I'm going to share with you, and I want to answer your questions, but I want you to stay until the end. If you have any distractions, I want you to mute anything, like tell your family, I'm in an info session right now. I'm learning something new, something amazing, something I've never heard of. And if you stay until the end, and then you also sign up for the weight and fat loss, if it's a good fit for you, it has to be a good fit, it has to be into alignment, then I have a product for you, an herbal product that's going to help you maintain the weight loss. Because it is one thing to lose weight, it is another thing to maintain. And to me, maintenance is the most important step, because you can just go to Mediclinic, you lose 5 pounds quick, right? You can just take a pill, you lose the weight. But how do we maintain it is very important to me. And I know the holiday seasons are coming, right? Thanksgiving is around the corner. It's in 2 months. And then we have Christmas. I would hate for you to participate in any of my program and then for you to gain the weight back. That's a no-no in my book. That is a no-no in my book. So as I was putting this together, I was like, okay, what can I give them when you complete? Because we're going to complete this program and right around Thanksgiving for you to continue taking like herbs, safe and effective, to kind of help you don't regain the weight back while you still have stamina, vitality, energy, brain, cognitive function, and feel your best. Okay? So that's at the end. But, who am I? Like, am I qualified to speak to you guys about weight loss? As I preface this at the beginning, weight loss is a thing I've been doing for a long time. I had a weight loss program called Weight Loss and Steroids, which I eliminated because my gut decluttering program is taking care of that. People lose weight all the time in my programs. I have no issues that you're not going to lose weight. I might be worrying about, some gut issues, but when it comes to weight, you lose weight. I guarantee you that. I am 100% certain that you lose weight. Everybody loses weight in my program under my supervision. But I'm Dr. Genty. I was a trained ER urgent care doc. I've been practicing for over 20 years now. If you combine my conventional training plus my functional medicine training, I mean, in other info session, I tell people how I got into this work, because my dad had cancer, multiple myeloma. My uncle had non-Hodgkin's lymphoma. I helped my dad recover from cancer for 6 months. Like, that's why I love functional medicine so much, so much, because the pills, the chemotherapy, radiation, these things were not working for my dad at all. We did everything. We did bone marrow transplant. Nothing worked until we discovered high-dose vitamin C infusion, and then herbs. And then I went to my own journey. I had fibromyalgia and had a lot of stress. I was bloated and constipated, overweight. I had sickle cell anemia. So I healed myself, healed my father, helped many people. So then I left my very well-paid job as a ER emergency room doc, back to doing integrative medicine, and we're back and we learned everything. Because in my training in the conventional space, I was trained to give meds, prescribe, spend 15 minutes with the patient, and then give them a pill and then shoot them. Okay, goodbye. Go follow up with your doctor. I didn't know anything about herbs. The things that I'm telling you today, this is years of practice, years of learning. I didn't know. I didn't know that I could tell my patients to take some echinacea or endographis for this flu season or for COVID that's out there. I didn't know I could tell my patients to take vitamin C, that will help with cancer. I didn't know that you can literally drink a lot of these herbs and then lose weight. So I left. I was very unhappy, overworked, burnt out. I was really getting paid very well, but it was not worth it. So now left the hospital, opened my own practice, and it has been a dream since then because I love what I do. Patients call me, they contact me, they tell me the little simple recommendations make huge difference. But my job is to really show you guys different ways of doing things. I don't believe you should put all your eggs in one basket, but I don't believe you should be just like have one way or the highway. Just like I'm talking to you about losing fat and weight and fat loss with herbs, could there be another product? Yeah, I'm sure there's another products out there, but I want you to open to receive. Okay. With functional medicine, I'm helping tons of patients lose weight, fix their gut, balance the hormones, get rid of autoimmune. Like I have reviews on Google's, people send me messages. I have a few here for you. So this is not like you under the right care here. When you're in my world, you get the best care possible. There's nothing like us here. And I guarantee you that. So I'm determined to bridge the gap, right? Showing you exactly the options out there because I feel like when you have options, you have power and you can make the best educated and informed decision for you. Okay. So that's why info sessions, webinars are very effective for teaching and learning. All right. So yes, Dr. J, I'm Dr. J. I have tons of experiences, right? But what I want you to really care about is, can I get your results? Can I help you? Have I helped other people? Is this information valid? Does it make sense to you? I mean, like literally, can I help you? Because so many times we see the expert, right? Like the expert, the well-known doctor, the best in the country, but yet you still left with unresolved issue. So all this is great, right? Like I'm not I'm not discounting all my effort. I work hard, but the question you should be asking for any doctors, can you help me? Can you get me results? Have you help other people get results in this particular area? And the answer is yes. All right, so this is the first thing here. This is recent. All the things that I have here, everything, all my testimonials, this is not on Google. These are people sending me messages, letting me know that I helped them, whatever recommendations program they're in, they lost weight. So this is from Adam. Love me some Adam. You can see just studying. This is this year. All this is this year, August, last month. 35 pounds. We're still working together. He's going to be part of the program. He's going to lose a lot more weight. This is Beth, whom I told to stop losing weight. She lost 50 pounds under my care with my products. She is, oh my God, Beth is the most easiest patient. I did, what was I doing? I did a Zoom call with the liver detox program that we had. And I asked them, like, what made you so successful? And she said, Dr. J, I just do it. I don't think about it. I don't contemplate on it. You tell me to do this, I do it because I'm paying you money. I'm hiring you, and I see you have a good track record. I just do it. So that's why she was able to lose 59 pounds. When I met her, she was on a ketogenic diet. She lost the weight, but she was so tired, so exhausted. I mean, she did not look good, if I'm being honest with you, and she knows that. And when we did her blood work, because she was part of the gut decluttering program, and I gave her my lipolytic capsule, which is part of this program, she started losing weight. She got energy, stamina, cognitive function improved. She wanted to just get out of the house and get things done. So this is her. All right. But let's talk about all the zillion trillion ways of losing weight. There are so many ways out there to lose weight. And I'm sure if you being honest with yourself, right? If we were to sit down and have a lovely conversations, you tell me that you've tried some of these things. All right. Restricted diet, starvation, counting calories, carbs, macros, over exercising, like going to the gym because somebody told you you got to go to the gym and exercise. That's a lie. That's a lie, my friend. You got to lose weight first and get energy. Then you go to the gym and exercise and tone up. Okay. Pre-made, pre-packaged products like shakes, meals, bars shipped to your house and you pay money and then the meal comes to you and then you lose weight. What's in that food? What are you eating? So why can't you replicate the meals at home, right? Injection, diet pills. I mean, I'm guilty of injection. I used to do HCG. When I went to my weight loss training, they told me I got to do HCG, the pregnancy hormones. Like give it to people, have them injected, and they lose weight. But that process, it was great. People were losing weight. I'm not gonna lie to you, but was it sustainable? No. And you have to have like 500-calorie diet. People were just starving themselves. What about Weight Watchers, Noon, Nutrisystem, Genicrec, Optivia, right? Like commercial weight loss products. What about surgeries? Like the gastric bypass, the sleeves, the lap band. Every single patient that I know who did the surgeries, they gained the weight back. Yes, the first few months you lose the weight, you get off your medications. Woohoo! But guess what? Comes back. And because you manipulated your stomach, right? You are eating less. You are not feeding your body. You're going into nutritional deficiencies. You are tired all the time. Like, no, it doesn't work. What about aesthetic? Right? The body sculpting, right? The laser procedures, put something in your stomach, the fat is gone, liposuctions. No, it does not work. Psychotherapy, acupuncture for weight loss. I mean, the list can go on and on and on and on and on. Because when you ask the question, how to lose weight, when you Google how to lose weight, all this comes up. Over thousands of ways of losing weight. But they are damaging to your body. They are not sustainable. They'll give you short-term results. They are not realistic, right? And these things are costly. Whether you paid $5 for Weight Watchers, but it's $5 for the rest of your life. Do the math. And you gotta keep, counting points or whatever, right? Like it's the side effects of all these things. Like many of these things have food. Like you can eat pizza on Weight Watchers. Really? Why can't I just go to my pizzeria and purchase pizza? Why Weight Watchers has a pizza I can eat, I lose weight, but my pizzeria place doesn't have, like, I want you guys to really, when you go through this, to make it make sense because I'm with you. We want to lose the weight. Obesity is huge, right? There's so many health conditions are tied to obesity and overweight. But does it make sense for the things that we're doing? We're not losing weight. You're tricking your brain, right? Like you like telling your brain, oh, I'm full when you're not really full. You have no food in your belly. You're not full. Hormonal imbalance, huge with obese patients. Digestive issues. Oh my God, I can go on and on with that. You are malnourished. You're not feeding your cells what it needs to work for you. Your cells are your little workers. They need to be fed to work for you. You need to eat to lose weight. That's metabolism. And then cancer. And then I'm telling you, these things are expensive. If you're trying to lose weight and you want to save money, this is not it. Okay? Yes, you might be paying $50 copay for Ozempic, right? But guess what? The insurance are not covering anymore. You might be paying like this latest, greatest product that you see on Google, $30, but $30 for how long? Are you really getting all the benefits of weight loss? I don't know. And one thing I want you to understand as well, when you are going to use any of these things here, those commercial products, the injections, the prescription medications, you better have the mindset that you are going to be on them forever. Okay? Because the longer you're on them, that's how you're going to lose the weight. The minute you stop doing them, the weight comes back. Why? Because you never really address the issue. You are in a deficient state. And then it does add up. Cost adds up. Copays are not a thing anymore. Okay, this is all public knowledge, not me making this up. You can Google it. All right. So again, I have, because many of you guys are a little skeptical. It's like, okay, Dr. Genty, herbs, really? Yes, my friend, herbs. These are the things. One thing that you will get from me and also from my team is education. I want to plant the seeds today, letting you know that there are a better way of losing weight, a more sustainable, realistic way of losing weight without you spending tons of money, going crazy, trying all the things. Like, this is a proven process. All right. So my lipolytic capsule is from Claudia. She's in my world. Love me some Claudia. These are like patients that keep coming back to me. I give her my lipolytic capsule July. This is this year. This is all this year. 5 pounds in 1 week. We also did diet too. I mean, we had a healthy eating. And she was active too. She was moving around. So this is not just like you take the pill and you do nothing. You will lose weight because the lipolytic capsule has herbs in it, which I will show you what's in it. But the more you do, because she had the stamina and the vitality, and she wasn't depressed and anxious anymore, she got up, she went for a walk, she had a dog, she walked the dog, she found herself, doing things with herself to kind of increase circulation, activate her muscles, and lose the weight. Okay? This is from Ashley. Again, I get a lot of feedback from my patients. When I was putting this program together, I emailed all my patients that took the products, right? And I said, hey, tell me your feedback. So this is what she says, right? She feels a lot better on the lipolytic capsule, helps with weight loss. And, that's something that she's thinking of taking with her and her spouse. So I can just blast all my, Googles, but again, you're not here for that. You're here to see how I can help you. If you want to see more of these reviews, Google, Google me. But I'm all about educating you, right? To motivate you, to change your life. I want you to take your health back into your hands. Okay? I want to empower you. Whatever results you want in this lifetime, you can get. I don't care what other doctors telling you what. Like, there's no chronic conditions in this whole world. Cancer can be chronic, but once you know what to do, you can really help cancer. So that's the goal today. I want to give you information so you don't become desperate. Because when we are into desperation, we go try all the things and then we lose money. We just get frustrated and we want to give up. And we have trauma and we're just like, okay, nothing's working. Even if you could find something that work, because of all your past experiences, you will not want to try it. This is from a colleague of mine, which is so true, because people don't talk to you about the hidden cost of obesity and overweight. So, yep, that's it right here. Cost of living is going up, including medical costs. That's why our insurance companies are denying left and right. They said obesity is a preventable disease, according to WHO, World Health Organization. They are not paying for obesity anymore. So that's why Big Pharma, coming out with a whole bunch of injections that are designed for diabetic patients, giving it to you for obesity. Okay, so you hear it from him. He is part of World Health Organization. But one thing he didn't mention here that I see a lot in my practice is that obesity, overweight can lead to cancer, again, autoimmune, mental illness, libido issues, sexual health issues, isolation. You know how many times patients will come to me, they don't want to socialize with anybody because they feel heavy. They don't feel good. And they feel like, it's like, why would I go to the, restaurant when I know that either I cannot eat or the food I'm eating is I'm going to pay for it, or just like, I just don't feel good, right? So we need to socialize. We need to have, this is life. Life is meant to be lived. We need to have fun. All right. So again, I'm using my patients because I don't know what your particular issues are on this webinar, but pivotal moments. When I ask my patients, what are the pivotal moments, right? When you wake up one day, you realize I got to do something. I got to do something. I've been managing this thing on my own. I've been trying all the things. My weight keeps increasing. I got to do something. This is what they tell me. They said, pivotal moments when they have tried everything and nothing is working, right? Like, I've tried everything, nothing's working. Have you really tried everything, nothing's working? When you are left with side effects from the products. I have a patient that took Wegovy and she ended up having a rash. Like, literally, her body told her, nope, we don't want that toxin in here. No. And she stopped. When you eat less and you're still seeing your weight climbing, I don't understand, Dr. J. I'm not eating. I only have 1 meal per day. I cannot lose the weight. I'm not eating. What is going on? Right? When you feel heavy, uncomfortable in your body, you have aches and pains. When moving your body is a chore, like you have, palpitations or shortness of breath, and you have joint pain, you can't move around, you can't run after your children, you can't go up the staircase, right? When you are tired all the time, brain fog, your body tells you need to lose weight, you need to get up and move. Like your brain tells you, come on, let's go. But your body's like, I'm too tired, let's just sit on the couch. Okay? When your doctor gives you a diagnosis that you don't want, you did not expect. When the prescription medications are not working anymore. Okay? When you feel chained or slave or prisoner to the pills, if you stop taking that pill, the weight comes back. So you have to go back on it. You feel like you have no choice, right? I got to do the injections forever and ever. When you spend so much money, but you know there's an answer and you're still looking. Okay? So my philosophy on weight loss, I mentioned to you guys at the beginning, we have 3 things: the mindset, which is the cognitive mental piece of weight loss; the physical aspect, implement a process that is sustainable, right? That's realistic, that is doable, easy is my middle name, I like ease. And then transformation, you should look good, you should feel good, look good, have stamina, have energy. People should compliment you like, oh my God, you look amazing. Thank you. That's what the transformation is. So herbal weight loss, which is not something people are doing out there. So we have something called repressed metabolic syndrome. That's when your body is storing calories as fat, even if you eat a lot or not, right? Again, Dr. J, I have a little tiny meal and I'm gaining weight. I can look at the food and I gain weight. Like if I have a penny for when people tell me that, I will be rich by now. So what you need to do to put your body, to reverse your body and put it back into like normal self, you have to do thermogenic state. You got to burn fat. Yes, you got to burn fat. Burn fat. When you burn calories, you burn fat, okay? So for me, a component of a weight loss, you can take a screenshot of this. You have to have increased energy. You got to burn fat. You have to have decreased cravings and overeating. You got to balance your hormones. There are fewer hormones that are involved in here. You have the leptin hormones, which is your appetite hormones, and then you have ghrelin and insulin hormones. But the weight loss, again, I keep saying this, it has to be sustainable and realistic. And you need to have no compliance issue. Like injecting myself, this is really hard, right? Like it should be an easy peasy. I take this, I do this, I'm happy to do this. I see results, I will continue doing this. No compliance issue. And there should be no resistance. Every time you do something, you're resisting it, it's not for you. Your body, the universe, God, something, they're telling you you're not into alignment, you need to stop. It should be ease, right? Like ease and flow should be the thing. And I use herbs because they are powerful, they are safe, they are effective. And we have used them for centuries without side effects. When you have the right formula, the right herbal products formula, and you couple that with lifestyle changes, and you heal your gut, you have a beautiful combination. Another thing that I love about weight loss, my weight loss, you got to have constant monitoring. Do not go to a practitioner, get pills and portions and meals, and then not be monitored. That's a no-no in my book. Like you got to talk, the practitioner has to know what's working, what's not working. Like you got to have guidance and supervision and support, right? Like if you go to a doctor and get herbs or pills, and then you are not being monitored on a weekly basis, if you ask me, that's not conventional with the wrong label on it. Like you got to, like, how do I know the thing that I'm paying for is actually working? Okay, so I'm going to tell a few things about ghrelin. So ghrelin, which is this one right here, it is an amino acid peptide that is synthesized from the human ghrelin gene, right? It is known as the hunger hormone. It is involved in the reward and motivation signaling pathways, and it is linked to stress, anxiety, and depression. That is why people that are overweight and obese, they are stressed. Some of them are anxious, some of them are depressed. Okay, because of that, they get sick very easily. Because when you are stressed and you have like, unbalanced hormones, your immune system take a toll. Now, the obese genes has like 7 chromosomes, like we have 46, 23 pairs of chromosomes, if you didn't know. The leptin hormones, leptin right here, it is the satiated hormones. That's the hormone that tells our brain that we are full. It is from your adipose tissue, okay? Which is fat, adipose tissue, which is good fat. Adipose tissue is connective tissue, okay? So ghrelin is like, ghrelin is the hormone that tells you you're hungry all the time, and leptin is the hormone that tells you you are full, okay? So when we are talking about hormones, we have to really make sure these things are balanced properly, all right? Now, the gut has a lot to do with ghrelin. Leptin is from adipose tissue. Now, this program is weight and fat loss with herbs. Let's talk about fat, because I don't want you to live here and be like, oh my God, fat is bad. Fat is bad. Fat is not going to work. I want to get weight of all of my fats. No, we want adipose fat. That's good fat. We don't want visceral fat. So adipose tissue is the good fat, and it has many regulatory functions like insulation, keeps you warm, protects your joints, protects your organs, helps create energy, helps manage insulin and glucose monitoring, but we need the adipose fat. We don't want visceral fat. So when I say fat loss, I'm talking about visceral fat, which is known as the belly fat, right? It is the fat that is stored around your abdomen, under your chin, under your arms. Like, we don't want those. And they, because of this, you can have major health issues. Like, visceral fat can increase your risk for diabetes, heart disease, stroke, any disease, cancer. And that's the fat we want to burn as much as possible. Now, let's talk about the Chinese herbs. That's where you guys came from. These are the Chinese herbs. Now, I know cinnamon. Many of you guys know cinnamon, but did you know wu gi? Oh my God, I'm Haitian. Here I am speaking Chinese right now. Is synonym for cinnamon, right? Cinnamon is an herb. Like turmeric is an herb. Like cayenne pepper is an herb. Did you guys know that? Now you do. So you need to have these herbs, and I have in my products, in my programs. That's what's gonna help you lose the fat. Bezu, abdominal fullness and distension. That's why you're gonna have flat stomach, right? It soothes your abdominal belly. Remember, the gut has a lot to do with it, right? And like this is in my capsule. Cinnamon, you guys can read this. Zinji, ZZ reduce fat by improving and eliminating habits, right? So you don't have like the cravings creeping up in the middle of the night or middle of the day. You have to eat something. Danghong is antimicrobial activities, because there's a lot that has to do with bacteria producing toxins, getting stuck into your abdominal fats and extending your abdominal your fat cells, and then you have big belly. But this, I love this so much because this also has vitamins, vitamin C, calcium, vitamin K, and more, magnesium. Dispel fat. This is the herbs that get rid of the fat. And then, of course, berberine for all my diabetic, insulin resistance, my PCOS. I love these herbs so much. But Chinese herbs are generally combined with in herbal formulation. You cannot take one of these herbs and like, well, Dr. Genty, I took this one. Why am I not losing weight? I'm gonna go, drink a lot of cinnamon. Why am I not losing weight? Somebody? Okay. I can answer that question later. So I don't you got to formulate them. That's the thing about Chinese herbs. 1, 2 might not do it for you. It's the formulation you have to look at, okay? And then, of course, you have to make sure your Chinese herbs has no solvents, toxic solvents in them, no fillers and binders. If you know me, I am anal when it comes to my supplements. I looked, I researched, I contact the company. Like, I am the problem child when it comes to my supplements, because when you lose toxins, you lose weight. Okay, we just finished doing a liver detox and people lost weight in that program because they lost toxins, okay? So, but you want to make sure your Chinese combination, because you can take a screenshot and find a product that has all these wonderful things combined. Make sure it doesn't have any titanium dioxide. Make sure there's no corn, no soy, no binders, no fillers. The only solvent this thing has, your product should have, or Chinese herb should be water, maybe a little of ethanol, then you can just evaporate it, right? But Chinese herbs are multitaskers, as you can see here. You have decreased pain, it cleans you out, no diarrhea, but like eliminating toxins, supports your liver and your kidneys, helps with sleep, helps with insulin, glucose management, improve digestion, enhance metabolism, revitalize weight loss. Like there's so many things you can do with Chinese herbs. These herbs, again, they are available. Is the dosage you have to look at and the formulation. Okay, but what I do, this is great. But for me and my patients, I want you to see noticeable results. So I couple this formulation with this right here. My lipotrophic or lipolytic capsule, my lipotrophic. So lipotrophic agents are a class of substance that play a huge role in body's control of fat and visceral fat. So when I keep mentioning fat, I'm talking about visceral fat, the one that we don't want, the one that leads to all the health conditions. Through the involvement in lipid and fat metabolism, lipotrophics help maintain a healthy liver. Here comes that liver again, preventing accumulation of fat in the liver. So many people are walking around with fatty liver disease because they have so much fat in the liver. These and these can be used long-term. If you're under my care, use my formulation, my products, you don't have to worry about stopping these things. Okay, like L-carnitine, many of you guys might recognize this. L-carnitine is good for diabetes. It's also good for weight loss, right? Long-term use, like there's no major side effects with these things, at least my products. I can speak for other people's products. They also increase average daily energy. Again, you gotta have that energy, that physical sense of well-being. You gotta have that. Like, we don't want to lose weight and be tired in the whole process. Like, that's terrible. You gotta have the cognitive function. You gotta feel good. You got to feel good. Again, my lipolytic capsules, I have a few products in the weight and fat loss. I added products besides my lipolytic capsule, but my lipolytic capsule alone gives you all that. Give you a lot of results. As you can see, Ashley mentioned and Claudia mentioned and other people mentioned, right? These and the herbs, right? Like it's a perfect combination. And that's exactly what I use in my practice to help people lose from 10 to 50. So that's why I mentioned at the beginning that every single human being loses weight in my practice, because we start with the lipolytic capsule. That is phase 1 in my gut decluttering program. You get the capsules, you start losing weight, because when you start losing weight, you start seeing results, and you can see you going down the dress sizes. You feel so good. I don't know about you. I'm like, wow, I feel amazing. I look amazing. And then your husband compliments you, your children compliments you, you have the energy, the stamina, you will want to continue with the program. But you don't have to go about the weight loss and you don't have to go about the gut decluttering program, because this also has a component. So this is the Chinese, and then we couple it with that. We have some herbs here too, but this is mostly amino acid, Meterion is amino acid, anisotol is amino acid, L-carnitine is amino acid. So there's no medications here at all. I have no meds here. And they all do wonderful things. They turn food into energy, so you can burn energy, food as energy, like it's supposed to be. Helps with cholesterol, helps with brain function, helps with PCOS, whatever. It just controls your weight. Okay, so by now you're like, okay, great. And I'm getting closer to time. You're like, okay, you should really be smiling. At least I am. I'm like, I give you the information. But at the end of the day, you might be thinking, okay, great, Dr. J, love the herbs, did the screenshots, you can have it, get the information. What I'm just gonna go ahead and Google and find a product with all these wonderful herbs and try it. Oh, you're like, okay, Dr. J, you got me. What do you have for me? Like, how can you help me? Because everybody loses weight. Whether you're doing a detox process with me, or you're going full on gut decluttering, I don't care. My hormone, you lose weight. My weight loss products, programs, you lose weight. You lose weight. That's just it. You lose weight and you have energy. These are the two most reported outcomes in my practice: weight loss and increased energy. So that's when I introduced to you guys weight and fat loss with herbs. Yep, weight and fat loss with herbs. That's exactly what you want to do. Now, this is not a program where I'm going to give you tons of medications, injections, super restricted diet. I don't believe in that stuff. This program is well comprehensive. It has everything you need to lose weight and fat. This is simple. The products will help you stay on track because as I mentioned, when you start losing weight, you feel great. You will not want to stop. You want to continue. So that's what makes it easy to stay compliant with it. Okay? You have decreased cravings. You have mood elevation. You're not gonna push yourself to do things. You're just gonna get up and do things. Okay? That's the beauty about the mood elevation. So again, as I mentioned, I have one product in this weight loss and fat loss program, my lipolytic capsule, that's part of the gut decluttering program. And also I had a part of, what other program? People Loved, and I have that product in there. What I did, I increased the dosage of the product and I increased the amount that you get. So I used to give people 30, people are gonna get 45, but I increased the dosage. I spoke to my herbalist. I'm like, can we go from mild to moderate? So then again, you have twice the effect of that product. Okay. So again, concentration, weight loss, you feel better, beautiful transformation. That's all in that product. Okay. So weight and fat loss with herbs. Again, you see it here. It is, don't lose weight and fat, better mood, more energy, decrease inflammation, decrease cravings. You're gonna feel happy. That's it. You're gonna look like this lady right here, right? But the transformation, because I wouldn't want you to enroll into anything where you're still struggling, like you feel miserable, you have no stamina, no vitality, you're tired all day long, right? So this product doesn't have a multivitamin because my lipolytic capsule is the multivitamin. And I do have a product that has a multivitamin in it. Let me rephrase that. I included a product that has herbs and B vitamins in it, but that's more so towards the end you get that product to help you with continue experiencing results. It is 2 months. I am one of those practitioners who doesn't like to drag people for months and years and ages. We don't do that. You come here for results, you get results, and then I teach you how to maintain it. Because if you were to work with a functional medicine doctor for longer period of time, you pay more money. And I know many of us want to save money. I'm one of them. It's like, Dr. Genty, how long does it take for me to really see results? 2 months? Okay, let's go. So it's 2 months for this program, includes everything. All my programs always include everything. I don't want you to search for anything. The meal plans are included, the products are included, group coachings are included, weekly access and accountability are included, like mindset is included. Everything you need for you to be successful includes everything. So if you have tried all the things to lose weight, like you've tried it, this program is for you. Because this is something you're not gonna try. We don't try with the side and you've never done it with herbs. Because if you have done it with herbs, then you wouldn't need to do it with medications, right? So all the products in this program are designed and tailored to lose weight. So there's no way you're gonna take a product, you're not gonna lose weight. No way. Because everything is designed for mood, energy, inflammation, cravings, weight loss, every single ingredient, as you can see in the 2 previous slides, right? And this program supports healthy weight loss. You're not going to look, sick or whatever. Great cognitive performance and cellular regeneration and maintenance, okay? But I have to be honest with you. There are 3 things you have to do to work with me. And I know I have a few of my patients in here, they will attest to that. Like, you got to be coachable. You're not going to pay money and hire me as a doctor. And if you're going to fight me, resist me, of course, you have to have questions. Something doesn't feel into alignment. I'm more than happy to teach you why I'm doing this something, or I'm recommending these things, but you got to be open-minded. Because I found that many people just have one way. You can't talk them out of it. And then the mindset they have is not working. They don't want to change. You got to be coachable and you have to be willing to take action. Because again, it's an investment. Not only forget about the money, but your time and your energy. Time is something we cannot recuperate. Once it's gone, it's gone. Yesterday's gone. This morning is gone. And you have to focus on progress, not perfection. So if you go into this process, you're like, I want to lose 20 pounds and you lose 15, that's progress. We're going to start with 15. And then you're going to rinse and repeat to lose the other extra 5 pounds, right? And you have to commit to never let your self-doubt get in the way. This is huge with a lot of my patients. I've done this 3 days. I'm not seeing results. I'm giving up. No. Sometimes we have compounded effect, right? Like you gotta give it time to work. Of course, with me monitoring you, my coach monitoring you, us checking on you on a weekly basis, we'll give you recommendations for you to try, things for you to do. Because again, we all have different body composition. We all have different things we should be doing. Looking at time. Again, some more testimonial. This is today. This patient just joined. It lost 10 pounds in 2 weeks. 2 weeks. Again, people always sending us emails. This is a patient, he lost a lot of pounds. He wants to purchase my lipolytic capsule. And he's purchasing my lipolytic capsule and just using the meal plan that he has, and he's continued to lose weight. He lost 31 pounds. This is July. And that's in 2 months, if I'm being honest, 2 months in the program. 31 pounds, just the lipolytic capsule. Imagine when you have my lipolytic capsule, my fat loss capsule, the herbal supplements, right? The meal plans that I'm going to give you. And then I don't know. So you might be saying, well, Dr. Genty, I'm good. I have insurance. I'm going to go to my doctor. But I want to tell you guys something. And I would love for you to share this with all the people. This right here is the reason why insurance is not paying anything anymore. So hear this, right? You go to your doctor, you want to lose weight. It gives you Ozempic. This is very common. This is how much people are paying for Ozempic. This is how much. And this is one injection. So how much are we going to pay forever until we die? You do the math. Even if the insurance is covering now, because it's a new medication, obesity is on the rise, this is how much. I want you to take a screenshot. This is Google. Go to Google. And well, you might be saying, well, Dr. J, I can just Google and get 12-week outpatient commercial products. Again, this is how much you're paying, $2,100, the most expensive one. And then the one that are very low caloric diet. Again, we don't do low calorie diet. You're starving your body. You will not lose the weight. $108. Well, what do you get for that? Okay. Bariatric surgeries for all the people that just want to do it because it's easier, right? $25,000. And guess what? The weight comes back. It doesn't work, my friend. It doesn't work. It doesn't work. It doesn't work. You might be, well, Dr. Genty, I'm good. I'm going to exercise. I'm going to diet. I'm going to do all the things to sleep better. Nutrition, I'm going to really eat all the things for nutrition, right? This is what you're going to say. These don't work. Yes, when you just start a new journey, you are going to lose weight. Then you're going to plateau. This is what I see in my practice. Oh, I was doing so well, Dr. J. I changed my diet. I stopped eating bread. I stopped eating rice. I stopped eating oatmeal. I just stopped drinking the pop, soda pop, all the things. I lost 15 pounds and I'm stuck now. Yeah, you are stuck because when you make any changes, your body's like, oh, thank you. Thank you for not putting these toxic things in me. So then you lose weight. The ketogenic diets don't work. You lose weight and then your cholesterol goes up. You plateau, my friend. You plateau and you have to find yourself at the gym, ever exercising, creating more inflammation, exhausted on the treadmill, hiring a personal trainer, and then doing this fancy diet, counting macros. Like, I don't know. This is too much. This is too much. This is too much. Okay, like you have options. You can do this. Oh, Wegovy or whatever. You can do this. You can do this. You can do this. Or you can do this. Lose weight and fat with herbs. All the herbal products, teas, protein, meal plans, shakes, smoothies. We get everything. 3 group calls. The reason why we do 3, again, we are controlling costs, right? Weekly guidance, monitoring, supervision from me and my coach, Len. Mindset coaching, like literally, because sometimes you want to give up. But what I found in my program, when you take the lipolytic capsule and the other products, you don't give up because the mood elevation that I mentioned, the inflammation decrease, the sense of well-being that you get in your body, you don't give up. So this program is $2,500. But if you sign up by Friday, because I do want to reward the people that are like, yes, Dr. J, sign me up. It's 2,100. So let's go back to how much you'll pay with Ozempic, right? This is Ozempic or whatever weight loss products out there, the greatest one. This is 2,100 for commercial products with no practitioner attached to it. You're on your own. You just eat the food they send you, eat the bar they send you, drink the shake forever. Oh, you'll be like, Dr. J, I'm just going to get surgery. That's good too, but what is the side effects of it? Google it. Or you can do this and lose the weight and maintain it. If you sign by Friday, you get a product that I give you to help you maintain it, maintain the weight. You could be gaining because holidays, and I have to tell you, when the holiday season comes around, you're in the lipolytic capsule. It's like this, it's like Dr. Jake, and you can't say enough about it. Yes, you're not gonna have cravings. Remember, this product helps with cravings, overeating. All right, you're not gonna eat because you're not eating a lot. You are managing your blood sugar, you're managing your insulin, you're managing your illnesses, you're managing inflammation. So I have 4 products. I am very simple. If you know me, we don't do the most here in my world. Products are effective, the less is more. We do not pop pills, take all these things, we don't do that. 4 products, we rotate. Like at the beginning of the process, you take 2. And then as we, go into the weight loss, you take more. I have herbal teas for you. I have something for fiber for all my constipated patients. The fiber product also helps with cholesterol because it has psyllium husk in it. It has flax seeds, also help with hormones. Okay, gives you some omegas. And then again, I have a product that's going to put you into ketogenesis, herbs, again, ketogenesis that I will give you. I have a craving control products that I give you if you sign up by Friday. And that product, you're not going to start now. You're going to start towards the end so you can continue taking it. It's a multivitamin that has herbs in it to help your cravings. Because I'm not going to lie to you, I'm looking forward to Thanksgiving and holidays, whatever holidays coming, I'm looking forward to that. I want to enjoy myself and I don't want to ask food for permission. I don't want to be miserable when people are eating and I can't eat and I cannot enjoy myself. I know 6 o'clock, I gotta spit it up. 3 group calls, guidance. Again, this is the price right here. Okay, that's the weight loss and fat loss with herbs. All the products are herbs. There's no medications, no toxic anything. All right, so again, I know for many of you guys, it's like, okay, money, where am I going to find the money? It's 2,100. Like there's a lot of money mindset. You probably have a lot of money mindset blacks right now. It's like, oh, it's a lot of money, $2,000 for results. For a practitioner to monitor you. This is my cheapest program right now. My weight loss and steroids, oh my God. My gut decluttering program is 6,000 to 8,000. This is 2,100. You lose weight. Okay, so again, whatever's coming up, if the money's coming up, I don't have it, I ask that you ask the universe or whoever you believe in. If you feel it in your body, it is a hell yes, you will find the money. We have payment plans. Okay, you can work with Marilyn, she'll work with you. If you're my patient and you've taken programs of mine, don't worry, we got you. We'll do extended payment plans. Don't worry, because I trust you. You've been in my world. The reason why you come back because you see results and you want to continue seeing results. All right, but the only thing that's stopping you from saying yes or gonna stop you from saying yes on Friday is the money. It's always money and skepticism. If it's skepticism, I'm telling you, you're gonna lose weight. I guarantee it. The money, I don't know. So this is for my patient. This is her now. This is her now. I didn't ask for so I had to buffer her name, but this is where results. Again, now this is the timeline for the products. We'll start the program on the 10th, October 10th, right? So we need 2 weeks. We're gonna have to ship out the products to send you everything. The last day to register for weight and fat loss with herbs is next week, next Tuesday. So you have a whole week. If you signed up this Friday, the 29th, you get the Crave Control products for you for the holidays. If you sign up on Tuesday, you don't get that. Why? Because I know a lot of people is like, okay, give me something to make me sign up, because your brain is saying, nope, I don't want to do this. This is too much money. I'm going to continue doing whatever I'm doing and continue getting the results. So Marilyn's going to drop the link here. But there's a link. You can schedule a call with Marilyn. She can register you. She can answer all the financial questions you have, or you can give us a call, or you can send us the something through the info. Okay, but we send you everything. The meal plan, there's a portal. If you've been in my world, you know you get everything. All you have to do is just trust the process, show up for yourself, be present, ask questions, raise your hands, and do all the things so you can get results. But if fear, scarcity thoughts, and negative past experience is coming up right now, please just push them aside, put them on the table, sleep on this. I'm not asking any of you guys to make a decision now. I want you to really think about this, but I know this is the program for you because you have never worked with a practitioner like myself. Usually, people will give you pills and say, hey, we'll see you in a month. For me, it's like every week I want to hear from you. Every week, we want to communicate. I want to know what's working, what's not working, because again, I value every single penny. I value you as a customer and I value your time. All right. So this is another testimonial. So people just send me information. So this is just, like 50 minutes. Like this lady took the lipolytic capsules and she only had 4 hours of sleep and has so much energy. Starting to like life again. Can you believe that? When you can just wake up and like, oh my God, life is beautiful. That's what she said. And when I got this message, I had tears in my eyes. This right here is worthless. Like there's no amount of money that can give you this. Because so many people have billions and billions of dollars and feel miserable. The money cannot buy health or buy happiness, right? But this, when she sent me this, I love this lady so much. I literally had tears in my eyes. And this is also from Vic because I check on my patients every week, like I would do with all of you guys every week. So he said, aside from weight loss, I've been great, meal plan, food prepping, along with supplement structures. I'm glad we've met and I decided to make this commitment because he was also hanged on the money too. He's like, Dr. G, I don't have it. This is $6,000. Dr. J, I don't have the money. Then he went home and looked at his life, look at the things that he's doing now, and decided to join. So all these Google reviews that we have, we work hard. We help our patients. These people don't pay. This is not covered by insurance. So people give us reviews, they see results. As long as you are committed, because I cannot care more than you do, right? If I see that you care, I go above and beyond. And I'm trying to find ways to have cost-effective programs to help people that are not, able to afford like the thousands of dollars of program. I would love to help you lose weight and fat with herbs. Okay, this lady's loving life. This guy's like, I am glad we've met and I decided to make a commitment. This is money, and he's glad he paid me money. All right, so we can agree you're experiencing increased weight, fat, fatigue, brain fog, anxiety, depression, frustration, irritability, like you name it, you can just put it here. You have tried many things and feel very disappointed and frustrated, right? You want to lose weight and fat without the meds. Like, really? I don't want to take all these latest tactics. I just want to do something and have somebody follow me and have somebody monitor me and have access to somebody. That's what I want if I was in your position, right? You want to fit in your clothes, feel lighter, have more energy, better mood, vitality, and love life again, and have less aches and pains and decrease your medication usage. The weight and fat loss with herbs will do all of that, right? I mean, of course, I'm not saying that all you have to do is do this program and then you're cured. No. You have to maintain the results and you have to continue working. Because when it comes to health, there's no destination. When you do the weight and fat loss and you have energy, you have all the things, and you can find the funds to join me in the gut decluttering program or the hormones, because this program will balance your hormones to a degree. Okay, this is not a program where, your estrogen is going to go up, your progesterone. Now we have a program for that, but you are going to lose the weight. You're going to feel good. And then you can focus on the hormone piece. So again, book a call with Marilyn, right? She dropped the thing in here and then she's going to help you register and ask any questions. Like, I don't want the questions to really stop you from considering joining this program. All right. So this morning I woke up and I got this from Crystal Fuller. She was in all of my programs and she's doing well. Dr. J's program are amazing. If you want my testimony, please feel free to reach out to me. Like literally volunteered. Literally volunteered. And of course, Dorothy, love me some Dorothy. I love all my patients. I just love for everybody. Like, you can tell when people do well, they have a sense of gratitude. My patients are very grateful. They're like, Dr. J, thank you. Thank you. Thank you. Thank you for telling me the truth. Thank you for being hard on me. I saw a patient today. His name is Charles. Like, at one point, I'm going to have him on the podcast, but he was telling me how easy the program is. He's like, it was so easy and he did so well. He's like, I love the way you explain things to me. You don't use a whole bunch of medical situation jargon, but it's easy and I'm able to take action because it's easy. So if you want to lose weight, you're like, oh my God, this is complicated. I'm telling you, this is easy. Why is it easy? Because you are not alone. You have someone on this journey with you. And you have the tools and the resources that will help you. And I'm guaranteeing you, you will lose weight. Like how much, how many, I don't know, but you will lose weight. That's a guaranteed. Everybody loses weight in my practice. Whether it's the liver, you lose 5-10 pounds in 2 weeks. That's a lot just to just detox. Oh my God, the clearing program, you lose 20 pounds, 31 pounds, 59 pounds. Even my cancer patients lose weight. Like, I don't want to lose any more weight. They're losing toxins. This program will literally help you lose weight. This is your call right now to do something if you want to lose weight and do it the most cost-effective way. $2,100 if you join by Friday. If you do not join by Friday, then you're going to pay the full price, $2,500. I don't know about you. You can save that $400 and purchase the food that's going to be in the meal plan. All right. That's it. That's all I have for you guys today. I am going to stop sharing and then we're going to answer some questions. Yay. Let's see. If you have any questions, you can either unmute yourself or put it in the chat because I know, 6:10. Okay. All right. Thank you so much for staying. I mean, I still have a lot of people here. Okay. So Ina said, Dr. J, are you talking about home? Okay. Now I answer that question. Hi, everyone. Hi. Hello, Shirley. Ashley, now I can build a sexy Adam with no flag. Love me some Ashley. Catherine says, in addition to the herbs, does your program include food restrictions? I give you meal plans and recipes, Catherine, right? So we do have a few toxins that are not included in the meal plans, like we don't do grains, we don't do rice, we don't do soy. Like we literally don't do a lot of the things that are causing massive inflammation and damage to your body. So but the easiest piece about it is like you look at the recipes, look at the meal plan, you just go cook the food and you just go purchase the ingredients. Easy peasy. So there's no like crazy restrictions, but you eat real food. To me, when you eat food from the ground, it's real food. But there's certain things I remove like grains, no gluten, no soy, no dairy. Right? And then in this program, we're also doing 2 days with no meat. That's going to enhance the weight loss. Only 2 days, you can do it. We do it as a group, right? I love giving your body time, decrease the stress, right? So Catherine says, oh, I love Catherine. Are the Chinese herbs that you mentioned originally sourced? Yes, they are sourced. I have an herbalist. out in California. That's where everything is. It's in California. You get everything in California. But yeah, they are sourced. I love my herbalist. He knows I'm very anal because in my practice, toxins is huge on my list. Toxins from your water, from the personal care products, from your household products, from the medications, from the supplements, from the environment. So we're trying to decrease the toxic load. They are sourced very well. Catherine says, on Facebook, you mentioned $350 for products. Is this the investment in your program? No. So the lipolytic capsule, 30 lipolytic capsule is $350. Yeah, $350. And patients are paying this. So the lipolytic capsule by itself with nothing else is $350. It's in the Gut Decluttering program. But this one is not, this weight loss program is not $350. With the amount of support and accountability and all the things, because in this program, you have 4, 5, you get 6 products that are designed for fat loss and lose weight, for moods, to decrease inflammation, to balance your insulin, the leptin and the ghrelin hormones. So yeah, no. The lipolytic capsule, which is the milder version, 30 caps, $350, and people pay it. And you get 45 caps, a higher dosage, plus my lipotrophic capsule as well, which is a different, it's in there with the inositol, that, and then plus the herbs, the teas, all that for the price, Kathleen. Are the 50 meal plans individualized or standardized? So the way, good questions. So the 50 meal plans are like recommendations and suggestions. You get to pick what's resonating with you. I don't like to tell patients what to eat. I give you options. I give you recommendations. Whatever feels good, you eat. Because if I'm telling you, eat rice today, which I have a patient, we had to create a meal plan. He asked, he's like, Dr. J, can you tell me what I should be eating Monday, Tuesday, Wednesday, Thursday, Friday, Sunday? I'm like, okay, you sure? So I did that for him. But when it comes to eating, because in my mind, eating should not be a huge thing that's going to cause problem. Because when you eat, you put in gas in your car, right? We should love food. We use food as medicine. If you're eating food and you're paying for it, something is wrong, right? It's either the food is not the right food for you, you have massive inflammation in your gut, or something is not adding up. So in the program, we give you recipes, and then you get to pick whichever one is calling your name, resonating with you. We do meal prepping, we prep for success, and then you eat the food. So individualized, I mean, you can individualize it yourself, but you get the most nutritious, nutrient-dense food. Oh, you come from Facebook, Kathleen. Kathleen Cole says meals, shakes, etc. How delivered? Okay, it's a great question. So the meals are recipes. There's a PDF. I use an app where I create my own recipes. I do my own recipes. I put the ingredients together. The shakes, and then we have smoothies. Those are recipes. Again, this is not the program when I'm shipping you things. Because the thing is, if I were to ship you the prepackaged, pre-made meals, you have to continue eating it for the rest of your life. And that's not the vibe. I want you to take power and cook the food and feed your body and lose the weight. Okay? You should never enroll in a program where you have to eat the things forever. When you stop eating the things, you gain the weight back. So it's a PDF. We upload into the portal, and then you see all the recipes, all the shakes, and then you just purchase the food and you just cook it. You cook it for yourself, you cook it for your family, you cook it in bulk, you put it in the fridge, saves you time, and you always have food in the fridge waiting for you. All right, so Marilyn dropped the link. Please schedule a call with Marilyn. You can call us. She'll be here tomorrow. You can call her and ask all the questions, okay? This is the phone number. All right, please describe exactly what is delivered. Okay, so what is delivered are the products. We send you a kit. Inside of the kits, you get all the products, like the capsules, the teas, the powder, because I have a fiber powder in the kit. And then we enroll you into a portal. In the portal, that's where you get the recipes, the shakes recipes, the meal recipes, and then videos, right? I record videos, instructions, how to take it. When we have our Zoom meetings, when we meet on, the Zoom meetings, we do it like this. You pop on Zoom, we talk about all things weight loss, fat loss, but every week in the portal, we are checking on you every week. Like I will probably say, hey, Catherine, how's it going? How do you feel? Do you have any tiredness? Like, hey, Kathleen, how's it going? How's your brain feeling? Like, this is what delivers. So we ship you a kit that has all the products. And obviously, I can't do that to the computer, right? But in the portal, the weight and fat loss portal, can I show you what it looks like? Maybe I can show you what we use a HIPAA compliant protocol practice better. Oops. Can I? It's not letting me. Why is not letting me? Okay. I don't have here, so I can show you what it looks like. So every communication system comes from the portal. So it looks something like this. For instance, this is the one for the gut decluttering program. So you get like welcome letters, phase 1, phase 2, phase 3, my approved list. So this is for the gut decluttering program. And then there's a chat portion. So this is where we'll be chatting to check on you guys every week. So that's what I mean by the portal. So what is delivered? Everything is delivered here. We have modules like so these are just, this is the back end of it. You probably don't see it. So everything will be housed here. That's how we communicate on a weekly basis. And then when we do meet as a group, we meet on Zoom, and then I put the recordings here. But the kit with the supplements get delivered to you. Catherine says, thanks for mentioning the fillers of solvent and herbs. Are they third-party lab tested? Yeah, yes, they are. My herbalist out in California is very, when it comes to testing for all the mercuries, for all the things, the lead, because California, they are very strict. Like you gotta really get these things under control. Okay. So, but Catherine, I would love for you, I think Catherine or Kathleen, if you're open to the idea, if you're still here, excuse me, I would love for you to schedule a call, right? So we can really answer more of your questions. Okay. I sleep about 8 hours every night. I do enjoy my sleep. Will these herbs keep me up? No. Absolutely not. As a matter of fact, they will help you sleep. Because so when it comes to Chinese herbs, it's going to do whatever needs to be done in your body. It's very adaptogenic in a way, like it's going to do whatever needs to be done. So it's not, oh no, sleep is huge in my world, because if you're not sleeping, you're not healing. So now this will not keep you up at night. Again, this is a link from Maryland. How is leaky gut related to weight loss? Ooh, this is awesome. So leaky gut, what is leaky gut? Leaky gut, that's when you have holes in your small intestine, and then toxins are leaking into your bloodstream, and then that travels all over your body, and then you have to, brain fog, energy issue, rash is also part of the leaky gut or unfiltered process from the liver. Now, this is related to weight loss because, again, the visceral fat in your abdomen, the fat cells hold on to the toxins. It's holding on to the toxins, letting it go, okay? So that's why that enlarges your fat cells, and then you have more of that, and that's why it puts you at risk for disease. So leaky gut creates inflammation. When you have inflammation, your body goes into fight and flight mode, and sometimes your body becomes very resistant to a lot of things that you could be doing. So the body's one machine, everything's connected, So leaky gut, SIBO, irritable bowel disease, with irritable bowel IBS, irritable bowel disease, or irritable bowel syndrome with constipation, you gain weight. Why? Because you are constipated, you're holding on to toxins. Because you're holding on to toxins, that increase your weight. When people do laxative or they do a detox and they go to the bathroom, they lose weight. So leaky gut, leakage of toxins creates inflammation, and your fat cells are holding on to it. Like when you have leaky gut, for a lot of people, if you have fat, the toxins traveling throughout your body and it's deposited in your chin, people have that double chin because the fat cells become enlarged. And since you don't have muscle here, right, it kind of hangs a little bit. Hopefully that answers the question. Let's see. Okay, you're welcome. Yeah, give us a call, Kathleen. Oh, thank you, Catherine. So happy. All right, yeah, I can't wait. Yeah, that's right. Dropping off. See you on Friday. See you on Friday. We'll go over your blood test. So how do the herbs help you with leaky gut? Okay, so the Chinese herbs, I think 3 of the herbs helps with leaky gut. So by decreasing the toxins and allowing your small intestine, the gaps to close together. Because there's also protein component like inositol, methionine are also protein in the program as well, that also help feed the gap as well. So the less toxins you have, the less inflammation you have, the more your body will have time to recuperate and heal. Okay? And again, these Chinese herbs, they help a lot with digestion. They help a lot with gut issues, because you cannot not address the gut if you want to lose weight, because metabolism takes place in the stomach, right, in the gut. You got to eat food to restore your metabolism to lose weight. If you're not eating, Yeah, you might lose weight at the beginning, but guess what? You're gonna gain the weight back. So when it comes to leaky gut, leaky brain, we are thinking about the toxins. And remember, some of the herbs, they help with detoxification or elimination of toxins. Less toxins, less inflammation, decreasing the stress on the body, and then the body has more opportunity to heal. Does that make sense? All right, Jenna says, will the herbs interfere with my nope, nope. Nope, herbs will not interfere with your meds because we have ways of taking them. We take them 2 hours before medications, 2 hours after medications, but these herbs are very safe. Despite what people learn on Google or whatever, Chinese herbs are very safe. It's how you take them, the combination, the formulation, and also the supervision by the practitioner. Okay? As a matter of fact, Janice, if you take the herbs, you might see yourself using less medications. That's what happened with a patient of mine. He got off his blood pressure medications. He got off his diabetic medications because the herbs have a lot. After the herbs, because I know this was pretty fast. The herbs have a lot to do with blood pressure, glucose, again, gut issues, belly aches, belly fats, right? And then with this one, reduces cholesterol, boosts your immune system, support moods, like a lot of brain function, food, fat, like these herbs are really, really good. They are multitaskers. They don't do only one thing, they do multiple things. All right. Like 6:30. All right, any other questions? All right, so we only have 11 people. Fantastic. So if you guys are done, we're gonna get off. What do you guys think? Any other questions? I highly recommend you contact us and schedule a call because I would love for you to take the opportunity of saving money, but also get the craving control, not appetite suppressants. There's a difference between appetite suppressants and cravings. Okay? Appetite suppressing your appetite, you can spend all day without eating. That's not good. Versus cravings, like you have a normal meals, but you don't have the cravings to go pick up a chocolate bar or eat ice cream because your craving mechanism here in your brain is being controlled properly, right? The hormones leptin is signaling your brain and let you know that you ate your food. You have no more space for any other unhealthy products. So there's a difference between appetite suppressants and craving control. I don't do appetite suppressants. I do craving controls. All right, thank you. Are there any herbs prokinetics? Some of the herbs do act as prokinetics because the most important prokinetics to me is ginger, right? If you have, again, my greater motor complex, like you need to use a prokinetic. Ginger is my thing. Simplicity is key, right? We love ginger. Also cinnamon can act as a prokinetic for sure. And what else? Ginger is one. Garlic. Garlic has sulfur. For some people, you have to be careful with that, specifically if you have SIBO. But prokinetic, we do ginger. But the herbs are multitaskers, yes. And the fiber that I have in these products also can serve as a mild prokinetic because it's going to restore the migrating motor complex to store that muscle so to start working. Once you free up the toxins, right, you go to the bathroom, you eliminate properly, you free up the toxins, you leave in room for your large intestinal muscles, that layer, to regain its strength so that you don't have to really have slow motility and have nerve damage. Because migrating motor complex is that wave life structure that pushes the things alongside. So that's what prokinetics do. But for me, it's ginger. You can just cut a little piece of ginger, put it into your smoothie, not a lot to make it like, for you to have burns, right? We don't want the burning side effects of it, but enough over time to give you prokinetics. But when it comes to prokinetics, there's a lot of supplements out there. I don't use them anymore because the products that I use is very effective at restoring the migrating motor complex. Catherine, you mentioned plateaus. Does that mean on this program? No. I mean like when people go and have a whole new lifestyle change, they exercise, they change the diets, you know, they do all the things without supplementing or without focusing on the fat burning piece, they plateau. Right? That's what I was referring that to. You can go and do all the things, change your diet, eat healthy, and then you're d'accord. Ah, you speak French? D'accord. Love it. So, and then patients will come to me, well, Dr. Genty, I have the temps à temps. I have a personal trainer, and I go to the gym 5 times a day or 5 times per week, and I'm eating healthy, Dr. J. I started losing weight and then I stopped. That is not enough. Because nowadays, these things that used to work 500, I mean, like last year or 2 years ago, it's not working now. So people plateau. When you start a fat burning mechanism and you have those herbs, those products inside of you, you can do all of the things you're doing. I mean, I'm not against hiring a personal trainer. I used to have one. I go to the gym, but you don't need to do that to lose weight. You need to lose weight and gain your energy, and then you go to the gym and maintaining it and like do core or, you know, tone up. All right. So that's it. We have 1 more minute. This was good, wasn't it? I love this. Should do it again. If you're interested in the weight and fat loss, again, Friday, give us a call tomorrow, because I know many of you are like, yeah, like I know I want to do this. Give us a call tomorrow, or like, you know, download this link that Marilyn dropped here and schedule a call. It's free, no pressure. I never convince any of my patients. I am a no pressure doctor. It's either you want it, you don't want it. I'm not here to convince you. It's your health, it's your benefit. The way I practice is completely different than most doctors. So you get a lot more than you pay for. Oh, thank you, Janice. Thank you, Catherine. We share this with my senior yoga student. Oh, thank you. Sharing is caring. And we also do, merci de rien. We also do free natural healing assessment calls. Like at any time, if you know anyone that's struggling, they want to get on the phone and talk to me, I'll do the same thing. Give them some recommendations. We speak with them for free, for 15, 20 minutes for free, no cost. And this is the same link, the one that Marilyn just dropped. All right. All right, so thank you so much. Thank you. I hope to see many of you guys in the weight and fat loss with herbs. And Friday, deadline to get the product that's gonna help you with the holidays, so you don't eat all the things, all the, you know, pumpkin pies and all the gravies. That's me, all the cookies. And we start on the 10th. So we're going to close registration by next Tuesday so we can ship all the products, register people to the portal so we can start having this party. It's only 2 months. I'm telling you, 2 months. I mean, we only have 3 months left in the year. So my question to you is, do you want to end 2023 like this? Like, I'm sure you don't, right? Like, you really want to end the year strong and start the new year on a different note. And this is the program that's going to help you do that. All right, so that's it. You have a fantastic rest of your day, evening. I'm gonna go home now, and I'll see you guys in the program. If not, then take care. All right, bye.
Good night, Dr. J.
Night.